This is Ken Massey, and Ken, you're the PA for this wellness center here.
Correct.
Tell us how long you've been doing in this particular place.
Okay.
So,
PA since 2006, but in this particular place, Wellness for Life opened up a clinic up north 3 years ago, and then this place has been here for 2 years.
2 years. This is Matt Hauser, and Matt works for Advix, which is a private employer in town that utilizes this in a co-op situation, correct? So, how long ago did Advix come in, and when did you start coming to the clinic?
Approximately 2 years ago, I believe.
You worked at Advix prior to them having a clinic?
Yes.
Tell me a little bit about what you see as a difference between what you had to do healthcare-wise before and what you do now, like coming in and seeing Ken or Dr. Patel or any of the other physicians here.
This clinic is handy for me. I don't have to use a half vacation day and go home and travel an additional 30 minutes or an hour to go to a private doctor. I can leave work at my quitting time and come here.
So the hours are convenient for you.
Have a minimal wait.
Ken, when you normally have a patient come in, but if you just describe to us in general what your responsibility is with the patient in general, to try and understand and to give them the time that is required to get to know and have a personal relationship with your patient. How does that all interact?
Yeah. First you introduce yourself, and then you kind of go over basically what kind of medical problems they've had in the past, what kind of types of medicines they've been on, and then we try and do some various questions about what's going on for that particular day, whether it be an acute problem such as back pain or sprained ankle or sore throat or whatever, or is it a chronic condition management, if they have diabetes, high blood pressure, that kind of thing. We go through, when's the last time they had blood work and those kind of typical questions. And then, maybe just some background person, if we don't know the gentleman or the lady, background about family and those kind of things to try and get to know them a little better. Because we got the time here to spend with them. It's not a 5-minute, hey, what's going on? Well, we got to get going. So I got another patient. It's a 20-25-minute ordeal sometimes that we really get to know and really dive deep into what's going on in personal lives sometimes. And
so it's like a holistic approach to medicine.
Right. Yeah. It's a wellness approach. Yeah.
Wellness approach.
It's a holistic wellness thing. It's more than just what's going on that day. Here's some pills. Get out of here, and I'll see you next time. That kind of thing. It's more of a what can we do to solve the problem and prevent future problems and get you off some of this medicine. We carry an abundance of medicines that can treat almost any acute or chronic condition. But that's not our goal. Our goal is to get you off that medicine and maintain more of a healthier lifestyle.
Great. Well, thank you, Ken. Appreciate you being in here, and I know you got other patients to see, so I won't hold you up. Thank you.
I'll see you again. See you later.
Thank you.
Thanks.
Matt, we appreciate you taking a few minutes out of your busy day. Just wanted to ask you. You had shared with me off camera, kind of made me a little emotional when you were telling me your story. And if you wouldn't mind sharing that story about your experience with the wellness clinic, having a wellness clinic here, what's made the difference? What's the compelling difference between now and before?
Like I said earlier, it's convenient. I don't have to use personal time off at work. I can wait till quitting time. Come to the clinic and have a minimal wait to get in to see the physician. In January 2013 I was diagnosed with colon cancer. I was having symptoms. I didn't want to take the time to go to a doctor or a specialist. I kept putting it off, and I came to the wellness clinic, and they talked me into having a colonoscopy, and they did my I was diagnosed with stage 2 colon cancer, and I just feel like if it wouldn't have been for the clinic here, that it would have been a higher stage.
What made you come to the clinic? That that had kept you away from going to the doctor before? What was?
Convenient. There's no cost to me personally.
So there was no copay.
No copay.
Okay, and is a copay with you and your colleagues a big deal for people? I mean,
Yes, it is.
that's a do I pay a bill or go to the doctor kind of scenario?
Yes.
So you think that's removed the barriers to access to care for you?
Yes, I do.
And so because of that, you give credit to that, to you coming and being diagnosed early enough.
Yes.
And so tell us about that thought process when did you know something was wrong, or did you have a feeling something's wrong?
Yes, I did. I knew something was wrong. I was having symptoms like fatigue. I thought it was my blood pressure, but I was coming here for that. And like I said, they just talked me into going for further testing. That's when they found it.
Wow. And when you were in the room, was it Lisa that was the person in the room with you at that time, or
Tiffany.
Tiffany? I'm sorry, it was Tiffany. Was it just that she asked all the right questions and took time with you? And
That's part of it.
yeah.
She basically talked me in to get the colonoscopy. I didn't want to do it.
So she was able to take enough time for you to convince you this is
Yes.
for your best interest, in other words.
Yes.
And so when you, because I've been in health situations myself, where you go, I'll get to it later, right? Isn't that the way? And then your family starts to say, go to the doctor, go to the doctor. So you came here, they convinced you to go take the colonoscopy, and you went for the colonoscopy. They helped you set up the appointment and everything.
Yes.
So tell us a little bit about that process. I know it might still be emotional for you, but tell us how that whole whirlwind, I'm sure it was a whirlwind for you. So.
Well, it was a shock. That was the last thing on my mind. But like I said, the wellness clinic, Tiffany set up all my appointments for me for the colonoscopy and the throat scope, everything, and they just worked with me.
Did she just leave it up to the specialist, or what happened afterwards? Was the wellness center still involved in your health care?
Yeah, I did go to a different specialist. I had all my records sent to the wellness clinic because I wanted them involved.
Mm-hmm.
Tiffany told me that any of the blood work that I needed, I could come here and get.
And again,
for no
because
cost.
no copay,
Right.
no cost to you. In closing, what would be your advice to other people looking at this wellness center model that are employed by private or public employers? What would your advice be to them?
I would strongly consider it. I was not familiar with wellness clinics before I started coming here. Like I told you earlier off camera, my wife and I were just talking 2 nights ago. If this clinic wasn't available, we would pay to come here. We've been that pleased with the.
Well, that's awesome. Well, thank you for your time. Appreciate you letting me barge in on your time, and we really appreciate you. And God bless you. I'm glad you're on the road to recovery, and you look like a strong, healthy guy. So I hope you have many, many, many years.
Thank you.
Thank you.